This is first trimester prenatal care, what to expect. So the exact prenatal care that you're going to receive is going to depend on your unique circumstances and your medical history, as well as where you live. But this is just going to give you an overview of what you can expect. So we're going to talk about what to expect at your first appointment, what to ask at your first appointment, what you can expect at subsequent appointments. I'm going to share some insider tips as well. So first appointment, you'll typically have an ultrasound to confirm your due date. Usually if you are before 10 weeks, that ultrasound is going to be a transvaginal ultrasound, which means we use a probe that goes in the vagina. We put a cover on it typically, and we do the ultrasound that way so that we can get the most accurate dating ultrasound possible. Just want to warn you that what happens all the time is that we get one date from your period and we get another date from the ultrasound. Happens all the time. Take a deep breath. If that happens to you, please don't be concerned that something is already wrong. It happens all the time. And sometimes you think that you're 8 weeks, but you actually come in and we're seeing a pregnancy that looks closer to 5 or 6 weeks, and you have to return in 7 to 10 days for a repeat ultrasound. It happens all of the time and doesn't necessarily mean that something's wrong. So the other thing you can expect at your first appointment is we're going to measure your blood pressure, your height, and your weight. If you are someone who has dealt with disordered eating or has issues with weight and feeling really triggered by seeing the number on the scale, please tell the office, tell your provider, have them put a note in your chart. You can always get on the scale backwards, and you can even ask them to not tell you the number and to only discuss your weight if it's 100% necessary. So here are the guidelines for weight gain in pregnancy. I will say that I suspect that 10, 20 years from now, we'll look at this and we'll think this was very rudimentary and basic, because I think that the actual appropriate weight for each person to gain is different person to person. And we will learn as we study pregnancy more, as we study long-term health outcomes of our babies more, we'll probably have a more nuanced understanding of, what is the right amount of weight to gain for you specifically. But right now, we don't have that data. We just know that these recommended weight ranges are associated with lower risk. So if you're underweight, if your body mass index is less than 18.5, then we typically want you to gain a little bit more weight. If you are quote unquote normal weight, then we want you to gain between 25 and 35. If you're in the overweight category, which is a BMI 25 to 29.9, then we say 15 to 25. And then if your BMI is 30 or greater, we recommend 11 to 20. So I will share that I have always, in all 3 of my pregnancies, I have gained over the recommended range of total weight. I do make big babies, and it's a chicken or egg situation. Is it because I gained too much that my babies were big, or was it just because they were big and that's why I gained more? But these are guidelines. I encourage you to talk about this with your provider. They are not perfect, and body mass index is also not a perfect tool. So this is what we have, and so I want to make sure that you're aware of these numbers, but these weight ranges, I think that there's a lot more nuance to this. And we want to be careful, especially if you have a history of disordered eating or, issues with weight and feeling triggered when your weight is talked about. I think we have to be really careful on this subject, because there can be a lot of shaming and anxiety that goes into this. And I've even experienced that, worried about what somebody's going to, what my provider is going to say about my weight. And so I just want to wrap you in a hug and let you know that you're not alone in being worried about this weight gain issue. Okay, let's move on. So you can also expect to have your provider get an in-depth history from you, including your medical history and your mental health history. If they don't ask you specifically, and they really, really should, about your mental health history, if you feel comfortable, please disclose your mental health history to them. It's important for them to know. They're going to ask you about prior surgeries. They're going to ask you about your prior pregnancies. They will ask you about your social habits. So please don't be offended if they ask you if you do drugs or you smoke or you drink alcohol. Something they have to ask everybody. They're going to ask you about sexual history. Typically, sometimes they leave that one off. They're also going to ask you about your family and genetic history. So if you have any genetic disorders that run in your family, and they should also be screening you for intimate partner violence, which is sometimes called domestic violence. And there's a very good reason for this, because we see that intimate partner violence tends to increase in pregnancy, unfortunately. So if you are in a relationship that there is intimate partner violence, I just encourage you to, to disclose if you feel comfortable with your OB provider. Understand that your OB provider may be a mandated reporter. So if you disclose intimate partner violence, they may be mandated to report it. And so you can always ask, and they can, if you need help, but you don't want to disclose because you don't want, people police officers showing up at your door or whatever, they can provide you assistance without the disclosure. It is your provider will know what their laws are in their state. And so it changes depending on what state you're in, but we are, unfortunately, OBs are used to dealing with this issue. And so we can provide support without actually getting, we can give you numbers and brochures. Most OB offices should have that. So yeah, disclose when you feel comfortable. This is also relevant to history of any disordered eating. That's really important for your provider to know. If you don't feel comfortable at your first visit sharing that, that's okay. Eventually, it would be helpful to your provider to know that. The other thing is a history of sexual trauma. Again, if this is the first time you're meeting this person, I don't want you to put yourself in an uncomfortable position. But at some point, it's really helpful for us to know if you've experienced that, so that we can, we should be doing this with every patient with exams, but pregnancy can be really triggering if you have a history of sexual trauma, and we want to make sure that we're mindful of that and helping carry you through that, because it's difficult. So do it when you're comfortable, okay? We're also going to do a physical exam. So that involves oftentimes listening to your heart, your lungs, a thyroid exam, which your thyroid is something that's right here in your neck, a breast exam. Breast exams are really, really important. So you can, if your provider doesn't go, do a breast exam, you can ask for one. We want to make sure that, we are identifying any masses or lumps early on. An abdominal exam is standard, and then a pelvic exam. If you're due for a pap smear, you may get a pap. A pap is a screening test that we do for cervical cancer or pre-cancer. So if you're not due for one, you probably won't get a pap, but if you are, you may get it. And then sometimes some providers will also do an oral exam and then an ear, nose, and throat exam. Okay. You can also expect some laboratory blood testing to be done at your first visit. Sometimes the blood is actually drawn in the office at your visit. Other times you're given an order to go to a lab. We also will collect a clean catch urine test. That's the one where they instruct you, you have a sealed urine container, you get that swab, you're supposed to void a little bit in the toilet and then collect your urine, because we're going to run a test to look and see if there's any bacteria in your urine. And then they'll typically review options for genetic screening and testing in this appointment. Especially if your appointment isn't until 10 weeks, they'll typically be talking to you about what your options are for genetic screening and testing. And a little bit later in this course, you'll find the genetic screening and pregnancy video. If you have any questions, it's a really, really complex topic. And it can, when you're in the appointment, it can feel like a lot of information is coming at you really fast. So it might be a good idea to watch this even before your first appointment. All right. The other thing that your provider will be doing is considering early diabetes screening if you have certain risk factors, okay? So what that essentially is, if we screen you in your first trimester for diabetes, we're not looking for gestational diabetes. We're really looking for pre-existing diabetes. So the ways that we can screen for that is to do a 1 hour or a 2 hour glucose test. So you drink a sugary drink and then we check your blood glucose levels. Or sometimes we'll just draw a lab with the rest of your panel called hemoglobin A1C. And that's just another lab that we use. We use it outside of pregnancy to diagnose people with diabetes all the time. Okay. The other thing you can expect at this visit, or sometimes it's at the second visit, is a discussion of aspirin if you're at elevated risk of preeclampsia. So we recommend aspirin for anybody who has any one of these high risk factors. So if you've had a previous pregnancy with preeclampsia, aspirin is recommended for the prevention of preeclampsia. If you have type 1 or type 2 diabetes, if you have chronic hypertension, if you have a twin or triplet or higher order multifetal gestation, if you have kidney disease, and then if you have any autoimmune diseases that have potential vascular complications, so antiphospholipid syndrome or lupus. Now, we also recommend aspirin for the reduction of preeclampsia risk if you have 2 or more of the moderate risk factors. So here are moderate risk factors. If this is your first pregnancy, if you have a body mass index above 30, if you have a family history of preeclampsia in your mother or your sister, if you are 35 or older. And by the way, if you are 35 and up, highly recommend watching my class on advanced maternal age, because I go through all the things that are different with advanced maternal age pregnancies. I think you'll really like that one. And it's very high yield if you're 35 and up. The other moderate risk factors, if you have personal risk factors, a previous pregnancy with a low birth weight baby or small for gestational age infant, or if you've had a prior stillbirth, or if it's been more than 10 years from your last pregnancy, and then if this is an IVF pregnancy. Okay. So, and we like to start a baby aspirin between 12 and 16 weeks. So that's why we tend to talk about it at the first appointment so that you can start it before your next appointment. The other thing that you can expect is if you have not gotten your flu shot and the flu shot is available, that will probably be offered to you. We recommend the flu shot as soon as it's available at any point in pregnancy. And then if you are eligible for a COVID vaccine or booster, they'll probably also talk about that with you. Okay, so the things that you can ask at your first appointment. So one thing you may be curious about is, how do you know who's going to deliver your baby? So you can ask, how does the labor and delivery call schedule work? So a call schedule for labor and delivery means, who takes call on labor and delivery? Is it only the people who are here in the office? A lot of times there's hospitalists, so there's OB providers who don't see patients in the clinic. They only work in the hospital. That's the only place. So you don't meet them beforehand. So if you ask how the labor and delivery call schedule works, they'll give you a rundown of, okay, so we have 4 providers. We each take call this many times a week. And then we have somebody who covers nights 3 times a week. This is their name. They don't see patients in the office. It just gives you kind of a lay of the land. And you may want to, if you're in a bigger group that has multiple providers, you may want to schedule appointments with these different providers so you increase the chance that you're going to know the person who helps you give birth to your baby. You also want to know how you're going to be informed of results. So some offices have a no news is good news policy, which means they only call for abnormal results. And some offices call for all results. Some offices have a portal, so they'll review the results and then they'll release results in the portal, and you'll get an email or you have an app where you can check your results, okay? Now, it's important to know that, because if they have a no news is good news policy, but you know that you're going to be worried about not hearing, then you can talk to them about that and say, I'm somebody I have a little bit of health anxiety, and so for me, I would really like to be informed of all my results. How can we do that? Can I call to get my results? And you can negotiate that and talk about that with your provider. Now, the other thing that you need to know is, if you have a question or a concern, how do you get a hold of them? OB offices will typically have somebody who's available to answer calls, questions 24 hours a day. Not necessarily a physician, but for example, something that's really common is if you have a question in the middle of the night or you have a concern in the middle of the night, you call the office and it's redirected to a call center. And then the call center will page the physician who's on call and let them know, oh, this is, call this patient back. They had a question, they had a concern, and then you call them back, whoever's on call. So they may have a portal where they respond to messages in a portal. You just want to know how you get a hold of people and who answers those questions, right? And those calls. And then the other thing you can ask is at what point in my pregnancy can I be seen in labor and delivery triage versus the emergency room for a pregnancy related issue? So different hospitals have different policies. I've worked at hospitals where if it was our patient and they were having severe nausea and vomiting, it doesn't matter how far along they were. If they were 8 weeks or 14 weeks, they could come to labor and delivery triage for that pregnancy related complaint. If they broke their foot, they'd have to go to the emergency room because we don't do that. But it didn't matter how far along they were. They could be seen in our labor and delivery triage for a pregnancy-related complaint. However, other hospitals have certain gestational ages where they do a cutoff. 20 weeks, 24 weeks, whatever it is. So if you have nausea and vomiting and you need to go to the hospital, you can't go to labor and delivery triage. You have to go to the emergency room. So it's just important to know for your hospital where your doctor has privileges or your midwife has privileges, what's the protocol there. Okay, so in your other first trimester appointments, you may be doing your genetic screening if you don't do it at your first. Again, shout out to watch the genetic screening video as soon as possible so you can know what questions to ask and have some information going into that. In the first trimester, you typically have appointments every 4 weeks. They're going to, the first appointment, you usually have an ultrasound. Sometimes you have another ultrasound if they, if they have multiple ultrasound machines in their office, you may have another ultrasound. Some offices, you have an ultrasound every time. I would say what's more common is an ultrasound at your first visit, and then after that, they use fetal heart tones, those handheld Dopplers, to get heart tones. Sometimes in early pregnancy, it can be hard to get the heart tones on those handheld Dopplers. And so we'll have to get an ultrasound and check a heartbeat that way. It always totally freaks people out when we can't find it right away. Just know that it's really common, especially in the early weeks of pregnancy. Then we also will check your fundus. That's the top of your uterus. And before 24 weeks, we're just checking that it's, growing and that it's kind of in the right place, but we're not actually measuring it. If you've been pregnant before, you might remember, your belly being measured. That happens later in pregnancy. That doesn't happen in the first trimester. And then we also will check weight at each appointment, as well as blood pressure. Then urine dipsticks. This is something that's not always done. So in the past, collecting urine and dipping urine was something that happened for all pregnant people every appointment. In 2014, they revised, in the United States, they revised the guidelines to say that actually all pregnant people don't need urine dipsticks at every appointment, only people who are higher risk. So some offices have moved to only, doing urine dipsticks for some patients, but not all. As you can imagine, that's kind of hard to figure out and coordinate. Okay, this patient needs a urine dipstick, this patient doesn't. So a lot of offices are still doing them for everybody so that they don't accidentally miss somebody who does need urine dipsticks. Urine dipsticks are typically looking for signs of infection. They may be used as a screening tool to look for preeclampsia or kidney issues. They can also tell us if somebody, they can also signal a fasting state for somebody who hasn't been eating at all. So if you come into the hospital with nausea and vomiting, we can look at things in your urine to tell us, okay, is this somebody who's technically in fasting or, their body's kind of in starvation mode? And it's also looking for signs of diabetes. So you may or may not do this as you move through your pregnancy. So as I said, influenza vaccination is recommended in pregnancy and can be done at any time unless you're sick or you have another contraindication to it. So if the influenza vaccine is not available at your first appointment, when it becomes available, you can expect that to be brought up. We do influenza vaccination in pregnancy because pregnant people are more likely to get the flu, and they also get much sicker when they do. So every year we have pregnant people hospitalized and oftentimes even on ventilators, on breathing machines, because they got the flu. And, for a young, healthy person, the idea that you'd be hospitalized with the flu is, really, really rare, but um, it's not rare in pregnancy for people who get influenza to get really sick and sometimes even need hospitalization. All right, so here are some insider tips for navigating prenatal care in your first trimester and beyond. So when you're making an appointment, if you have there's a big office and you're wondering who you should see and who your primary OB should be, you can ask the staff who they like, because the people who tend to be nice to their staff also tend to be nice to their patients. So the scheduler, if you ask the scheduler, like which doctor do you really like, or which doctor would you want to go to, not a bad person to ask. You can also ask the medical assistants, like the people who take your blood pressure and dip your urine and stuff. You can ask them. You can say, hey, who's your favorite provider in the office? I'm trying to figure out who I should schedule with next. You can also, a lot of OB offices can run behind. And that this is more common in offices where they don't have a person who's dedicated on call on labor and delivery. And so sometimes, like if a baby is being born or a C-section needs to happen, somebody needs to leave the office and go do that. And that means that patients are waiting for long periods of time. So if that's really, you don't have time in your day for that, the first appointment of the day is a good appointment to get, because your doctor is much less likely to be running behind already. The other thing is, for your first appointment, some offices have those like just really awful paper gowns, and some of them are really small. They've started using gowns that cut off right here, and especially if you're a person in a larger body, can be really, really uncomfortable. So please know that you can bring your own robe. You don't have to use the paper robes that we provide. And then if you have an office that tends to run behind, please bring snacks and water, because sometimes you can be there a long time and I don't want you to be hungry and thirsty. Okay, the other thing that I want you to do after your first appointment is to evaluate your provider. And that's because it becomes increasingly more difficult to switch providers as you move through pregnancy. So if something's off at the beginning, it's much better to switch at the beginning than it is to switch in your third trimester. So when you walk out of the office, ask yourself how you feel. Evaluate the office staff. Were they nice to you? Were they accommodating? Did they make you feel comfortable? And ask yourself, is this the right fit for me? It is okay to, if you don't feel like your office is the right fit, to try out another office and get a vibe and see if that's the right office for you. All right, my dear, you are magic. I'll see you in the next video when you're ready.